Hello, I'm Ethan from Birdman Strength.
And I'm Andy from Brotherhood Health and Performance. And today we're going to look at the mechanics that surround submissions and the injuries that can occur. For this video, we're going to be looking at the outside heel hook.
Once we've looked at the technique and the finishing mechanics, we'll look more specifically at the structures involved, and then we'll look at a little bit of rehab too.
Okay, so with the outside heel hook, again, as we've spoken about in some of the other videos, whenever we're looking at a distal joint manipulation, we want to make sure that we're controlling either side of that joint. So we're looking at controlling the ankle and we're looking at controlling the hip in some way or another. This allows us to fix these structures in place, and then we can express force through the distal joint itself that we're trying to attack. So this, similar to the inside heel hook, we're going to use our legs to lock off Ethan's feet, whichever way they may be. As I said, we're not too worried about the finer details of the submission application. And we're going to look to take Ethan's heel within our in our elbow and control that heel from that position. So similar to the inside heel hook, the mechanics behind it are the same. We're looking to pin the heel as we can and then create braking force through the knee, through driving our hips forward and rotating through the ankle. Okay, so obviously we've spoken about the mechanics behind the submission itself. Now we're going to look a bit more at the injuries that can occur due to these mechanics. So obviously primarily in most heel hooking situations, we're looking at creating pressure on the knee. So when we come into the position and we start to create torque, we start to rotate and drive our hips forwards, then this is obviously going to create a lot of pressure on the knee. So primarily we're looking at the LCL ligament, which is this big ligament that runs on the outside of the knee. We also potentially have ACL again, due to the ACL's relationship with rotation of the knee, and within the knee structure itself. From there, we have a bit more of a rotational element, similar to the inside heel hook. When the position slightly changes, it may change the mechanics, and that can lead to different types of injuries within the lower leg. So if we start to rotate a little bit more with the ankle in this position, we start to get a lot more pressure on the ankle as opposed to the knee. Now this can lead to multiple issues within the ankle itself. We have a group of ligaments that control the sort of rotation of the ankle. So we've got the CFL, we've got the ATFL, and we've also got the muscles on Ethan's foot itself that are involved in that flexion of that, obviously, which we're going to explain further in a second.
The main movement is varus stress. That's the opposite of valgus. And as I put this knee into varus, you can see this LCL on an enormous stretch. We've also got internal tibial rotation, and we don't have an awful lot of tibial rotation, about 10 degrees. The ACL is the ligament that's going to stop that from happening. So if we put this into enough internal rotation accompanied with varus, the LCL and the ACL are going to be in a big trouble. If we keep rotating, we're also going to put a lot of stress on the MCL. Let's look down now towards the ankle. Because of the way that we're hooking the heel, we're putting this foot into forced inversion. Same mechanics as a toe hold. That's going to put stress on the lateral ankle ligaments, the ATFL, the CFL, the PTFL. So to summarize, the lateral ligaments of the knee and the ankle are in big trouble with the outside heel hook.
So obviously before we move on to giving recommendations from a rehabilitation standpoint, it's important to note that these submissions are effective for a reason. They're very efficient in the way that they're utilised and the mechanics behind them in terms of doing damage to your limbs. So the best advice we can give you is about monitoring your training properly, making good decisions when you're on the mats, tapping early and knowing the positions that you're in before you start to try daft things to get out of them. This is where most of the injuries will occur, especially when you're dealing with an uncontrollable opponent that is trying to inflict damage on you.
So when we're looking at rehabilitation from the damage done by an outside heel hook, we're going to be looking at the lateral ligaments of the knee and the ankle. So we're going to notice probably swelling in the early stages, which we'd like to reduce. You're going to have instability of the ankle and the knee, and that's going to depend on the severity of the injury, how unstable it's going to be. So what can you do at the start as like a starting point? What can you focus on? Like I said, reducing swelling at both joints. And when we look at the knee, we're going to be trying to get quadriceps activation straight away. So if we can get full extension of the knee, that's fantastic. And then working into getting flexibility back into knee flexion. And then we can start really loading the knee. With the ankle, we want to weight bear as soon as possible. The earlier you can start ankle weight, full weight bearing with the ankle, the lower the risk of future injury. Once we've got that good baseline, we can start moving on to more advanced rehab.
So similar to the inside heel hook, the sort of progressive rehabilitation and strengthening standpoint to the outside heel hook is very similar. Most of the processes don't change. They're about making sure that the structures surrounding the joint and that influence the joint are going to be strong, healthy and robust. We do this through basic loading patterns that you'd see every day strength programs in terms of squatting, split squats, lunges, making sure we're utilising a lot of hip extension, whether that be through RDLs or working more distally in terms of the hamstring behind the knee, through hamstring curls and things like that. We also want to make sure that we're supporting the ankle structures themselves. Obviously there's a degree of stability that comes through these bigger compound movements, but we can implement certain isolated movements to help with that structure itself, and again help keep those joints healthy, help keep them robust, and help deal with the demands that come from training on the mats.